Thank you for joining us with Encephalitis 411. Today, we are very happy to celebrate and honor and recognize World Encephalitis Day. So thanks for joining. We have a very interesting discussion today about the doctor and patient journey. Jennifer and Arun will be speaking to that. Just before we get started, though, I'd like to just tell you a little bit about Encephalitis 411. We simply exist to improve the quality of life for those that have been impacted by encephalitis. And while that is a simple statement, it's a very big statement because we recognize some unmet needs here in the United States, especially, and want to make some contribution to both advocacy and awareness, as well as the research aspect. So in that spirit, we work with both caregivers and survivors along their paths. We have a hotline that people use. We have email. If you go visit us on encephalitis411.org, you'll see that as a means of reaching us. You can also follow us on Facebook. We also work with clinicians like Arun and several others that we have as part of our medical faculty. Honored to know them and really appreciate the hard work that they do in the spirit of helping people along this very, very tough journey. And also just in the working with the general public in terms of awareness, so that when we start to recognize symptoms that people might realize encephalitis might be a possibility and they've heard of it before and are able to get the right medical attention. We have several initiatives. I won't go through these, but just know that we are working very diligently with both the medical community and the patients and survivors to improve your experience. And like I said, in the spirit of World Encephalitis Day, we're excited. We're all wearing our red in honor of those who have been impacted by it. We have a series of webcasts. This is probably one of several that you have seen either today or throughout the series. And on Saturday, in the Dallas area, we'll be hosting a in-person meeting in conjunction with PATE Rehab, as well as the Center for Brain Health. And those topics are brain plasticity and rehab options. So I will turn it over to you, Arun, and let you and Jennifer take it from here. Thank you.
Well, thank you, Becky. Really nice to be here on World Encephalitis Day. I am wearing my red, as you can see. And I'm looking forward to chatting with you, Jennifer. So, Jennifer, maybe we can just kind of get you to start things off. How did things begin?
Yeah, thanks, Arun. I think I have a story that's similar to other patients I've heard. About 3 years ago, I started feeling a numbness in my right foot. And I thought, well, that's really weird. Why can't I feel my foot? And I thought, okay, gosh, must have been, the walking I did on that last business trip. But after a while, it kept bothering me. And I went to the doctor and said, it's weird. I feel like I can't feel my foot. Who I met with had said, well, your feet are too small, and asked me to take my shoes off and traced my feet and held the piece of paper up and said, now go out and buy shoes that are bigger than your foot. And I thought, that's not the recommendation I thought, or the exploration of symptoms, but okay. And months passed, and my feet, I continued to feel a lot of pain, and then I started noticing headaches, but I of course didn't correlate those in any way, and kept going back to the doctor around my foot, said something's not right here, and just kind of came up at no real solution. During the course of these several months, I kept going back to the doctor saying, gosh, I'm getting dizzy, I have a lot of dizziness, and I'm just not feeling myself. But I think when I look at that, I gave them a fair amount of vague symptoms that were around, headaches, dizziness, tiredness, couldn't really think straight. And each time the doctor would tell me that I needed to, kind of work on my stress levels. And it made sense. We all have busy lives. And I was in a pretty, I would say, significantly challenging job with a lot of responsibility. And so it sounded about right.
And Jennifer, can I ask you, in that initial phase, what were you most concerned about?
Well, I was looking at everything separately because it didn't feel to me like any of these things were connected. And so, the foot, I thought, okay, I'm just doing what I can. This is a pain, but the doctors, are telling me this will resolve itself. What really caught my attention, though, was when I felt like I didn't have clear thinking, and that I would be at work and I couldn't track a conversation. And it was a very odd feeling for me, because it's something just didn't feel right about that. And that was the thing that worried me the most initially. But I didn't know how to push back on the feedback I was getting from my PA, the nurses and the doctors I'd seen, who said, just deal with your stress and this will go away.
And did that, it sounds like there were a number of symptoms. You mentioned that some of them seemed a little vague. The idea of stress had been brought up. Did that sound reasonable to you at that time?
Absolutely. I was in a pretty, I would say, pretty stressful role at work at the time, lots of responsibility. And I thought, sure, I must, just be having my body just is really reacting to this. But little did I know how much worse it was going to get. But for months, and it was a months-long journey of this, I thought, yeah, I'll do what I can. And so it definitely seemed reasonable, but it was frustrating, very frustrating.
Yeah. So I know you'll tell us about how this evolves, but I think that already what you've described are symptoms that are shared by a number of people with encephalitis. And I think one of the things that we as a medical community have really learned over the recent years is that encephalitis doesn't have to present acutely. It doesn't have to be something that takes you from where you were completely normal to bedbound or comatose within a few days. Now, there are some types of encephalitis that do that, but we're recognizing more and more some of these types of encephalitis that evolve over weeks to months, and that initially can actually have symptoms that seem fairly nonspecific. And I think that's what you're describing.
Absolutely. I did. There were times when I thought to myself, I'm wasting my doctor's time by coming in and talking about this, because everybody has headaches at one point or another. Everybody probably feels unusually tired. And I felt bad. I felt bad keep going back and asking for help, because I thought this is just part of life. You need to, in some ways, I thought, just suck it up and you'll get past it. And so that was a tricky part for me, was trying to sort out how seriously I should take those symptoms. And that's something that I, in retrospect, I know that you don't know what you don't know, but it was something obviously now I look back and say, wow, all these things make sense. But at the time, it didn't. It was a mystery to me why I was feeling so.
I hear you. And I think this also brings to light the idea that I think when we feel differently than we normally do, I think there is a tendency to try to suck it up and move on. And I think sometimes when people around us also don't really appreciate the full nature of our symptoms, that's sometimes the advice that we're given too. And so I think particularly in some of these initial phases of the disease, it can be difficult to either support yourself or to even feel supported by others as you're navigating these symptoms.
Yeah, absolutely. And I think I've done a lot of reflecting back on, because this was obviously a life-changing experience for me. But I do now have people who come and say, I tried to tell you that you weren't yourself. I tried to say something to you. And yet, again, I didn't chalk it up to something that was, potentially life-threatening. Where I know that there was a turning point where it started to get stranger and stranger. And, I had where people have told me, you started having these sort of fantastical conversations, and that you were going to jet away for the weekend, though it was Friday night, or just these sort of strange comments. Later, people told me that at work I had begun shutting all the blinds in my office, shutting out the lights, and was working like I was a hermit, even though I'd been known to be a very social, very gregarious person, and always had my door open for people to come by and chat. And I had completely changed. And yet, even when people said, is everything okay? I just said, I'm a little tired. And that went on for a period of time.
So things were they were starting to evolve. Why don't you take us through the rest of the evolution of your symptoms?
What ended up, I think the turning point for me, and I don't know if this was part of encephalitis or was just a fortunate thing to happen. But after about 4 months of this, I ended up getting shingles, and I didn't know what it was. I thought, I've got a rash, I've got some irritation, and so I tried to treat it, and but the pain became significant enough that I went into the doctor again and said, gosh, I feel so bad. I've been coming in. I've been seeing you guys so many times, over the last few months. But I don't know what's going on with this. And they looked at me and said, shingles. And okay. So sent me home with acyclovir and some pain medication. I took, I think half a pill, and then a few days after that, I really started to feel very swim in my head, and I thought, man, that must be an allergic reaction to that pain medicine. Of course, you can pick up on the fact that wasn't probably the most logical of things, to conclude, given the time that had elapsed from when I'd taken that medicine, and I really started to feel the dizziness, the headache, and felt just there were moments where I just feel like I'm going to pass out, and could not at that point really understand anything that people said to me. But that for me, just it was alarming, but not super alarming. And I made one final visit to the doctor, and I said, I just got to say something's wrong here. I gave him my sort of self-diagnosis, if you will, of that I had an allergic reaction to this pain medication. He did run me through some diagnostics as far as to see if I had like inner ear dizziness, like that. And sent me home and just said, I think, again, just reiterated in notes that I should take a vacation, get a break from work, and things would be okay. The good news was this particular individual did say, given that I just had shingles, that he would follow up with a neurologist. And that was incredible timing, because everything was going to unravel in the next couple of days after that, physically for me.
So we've kept people in quite a bit of suspense. So why don't you go ahead and tell us how things unraveled?
Yeah. So I ended up, and this was a strange experience to describe, but I was sitting at work and decided I needed a piece of gum. And a colleague of mine always had a fun little stash of all the gum you could imagine on her desk. And I went there, sat down at my desk, tried to unwrap it and put it in my mouth. And I could not coordinate my right arm. I could not move that gum to my mouth. And I thought to myself, that gum is broken. And I threw it away. I said, I need to go get a better piece of gum. And walked down the hall and got another piece of gum, sat down at my desk, same thing happened. Could not move my hand to my mouth. I thought, what is wrong with her gum today? Threw it away, walked back down the hall, got another piece of gum. I I think she told me later that I did this 5 or 6 times, that it was just this absurd matter of walking down the hall, grabbing a new piece of gum without explanation. And I wouldn't sit at my desk and think, man, what is wrong with this gum? Around that time, I had noticed that I also was getting all these phone calls, but I couldn't figure out how to answer my cell phone. And after a long, long time, I finally figured out how to listen to one of the messages I'd gotten. And it was from the doctor who had seen just previously to that, and saying, I need you to get to the ER. And said, we think you know what's going on. And at that point in time, the guess was that I was having an encephalitis in reaction to the shingles. And that's where everything started to come together.
I see. So now there seemed to be a hypothesis that might explain what's been going on. Certainly, what had been going on recently, but perhaps still not satisfactorily explaining what had been going on for the months prior to developing the shingles. So
Yep.
In any case, you got to the hospital, and I imagine they ran some tests.
They did. This is where things get fuzzy for me. It's a pretty emotional time because I start to have blanks in my memory. I have literally no recollection of getting to the hospital or even being able to drive myself. But when I look back over my records, I saw that they did an MRI, which didn't show anything at the time particularly suspicious. They also did a couple of spinal taps, saw some things that were unusual, but again, not that didn't suggest that I was having a herpes. I guess it's the HSE, the herpes encephalitis. So they, at the time, then ruled that out and didn't have an explanation for what was happening.
So it sounds like they were really looking for encephalitis, perhaps related to the shingles, which is caused by varicella zoster virus, VZV, which is related closely to HSV, and so certainly makes sense to look for both of those. I suppose if we put all of your symptoms into context and the fact that things evolved, it sounds like over weeks to months, really. And that some of your symptoms were initially subtle, but then certainly involved some cognitive dysfunction. Definitely by those last few weeks, it was quite profound. And in fact, the last couple of days, the fact that the MRI was unremarkable and that the spinal fluid didn't definitively show evidence of infection, I imagine at this point that they really were thinking this was probably an autoimmune encephalitis.
This is where it's a little, I'll say, still a little fuzzy for me. I believe in 6 weeks, my neurologist had reached out to an infectious disease specialist at the University of Washington. And they did come back to an autoimmune after this period of time. Did come back to the idea that it was an autoimmune encephalitis.
So how did they then approach treatment?
I ended up getting high doses of steroids, which I respond to pretty well. Of course, the challenging situation was that just because you respond to it doesn't mean you're out of the woods from a symptom perspective. And I had pretty much lost for a period of time language skills. I didn't know the words of common things, kind of spoke gibberish. There's a period of time where my mind went completely blank and I didn't know how to talk. And it was an incredibly scary period of time for me. But as my family was there and helped reassure me that, that things were getting better, in spite of the fear and kind of the confusion that I had.
Well, many patients describe a feeling of losing their minds, and that is really scary.
I think it's hard to describe to people, but that losing your mind, losing the sense of who you are, it's very disturbing. It really kind of sets you, I would say, kind of psychologically. There's a sense of unmooring because nothing you do about the world makes sense. That for me was incredibly frightful. In fact, just terrifying at night. I would remember just almost trying to rock myself to sleep because I was so everything was so uncertain.
Yeah. Well, it does sound very scary, profoundly so. Tell us a little bit maybe about how you got from those depths to where you are today.
Yeah. I will say that there was no silver bullet. It was a number of different things. I was fortunate to have a very, very good insurance plan, which allowed me to do extensive physical therapy. I did occupational therapy to work on my hand movement for a period of time. And also importantly for me was the cognitive therapy. I was able to get a neuropsychological report, which was very helpful in identifying various deficits that of course, my mind wasn't there, so I couldn't recognize that I had them. But that was really helpful in guiding the types of cognitive I got. I also tried a number of different alternative therapies. I did acupuncture for the dizziness. I did a lot of things. I had incredible light and noise sensitivity. So I found musicians' earplugs that could help to tune out noise. And so there were a number of things, but I would say the most important thing along the way, and I give credit to a friend of mine who's an educator, and she took my neuropsych exam and created her own sort of additional rehab for me and said, here are the things we need to work on. Here's the curriculum for you. And she was very aggressive about saying, you have to do the work. You cannot be passive. You cannot just sit here and hope that things will get better. And that was, I will say, probably one of the most profound, I'll say, and most impactful things in my recovery that I think made things possible for me to get as good as I can at this point in time.
Yeah. That's amazing. So, just in summing up briefly here, it sounds like there were a number of aspects of your case that made it difficult to diagnose: the insidious onset of the disease, some of the non-specific symptoms, particularly early on, and it sounds like probably the lack of biomarkers that definitively made the diagnosis. On the other hand, in terms of treatment and recovery, it sounds like you had access to resources and to support that were really helpful. And I think particularly speak to the benefits of individualizing therapy, which is not really available to everybody. And so I think you're quite fortunate in terms of being able to receive that type of treatment during your recovery period.
Yeah, I have heard and seen others who have not had the same level of access to resources. The one thing that I would say, though, really helped is having a person advocate for you. I ended up, ensuring that I never went to a doctor's appointment by myself. And I had both friends, family at different points in time join me in both appointments with my neurologist, to push. We got to find, we got to dig into this more. This is not who she is. We're not with her this. And I think that was important as well in meeting with my the therapists who were part of the recovery team, because having someone say, this is where she was professionally, this was how she was operating, this is what her capabilities were, and just because she might test, in your average range, that's not sufficient. And so I was able to get advocates who push my clinicians and push them to, support for additional therapy as well. And of course, as a patient, you don't know what your insurance plan covers. You don't know, there's a lot of details, but when your brain's not working, you can't figure these things out on your own. And so having people around you and who know you to also help in that way, I think is an incredible thing that I had, and I just certainly encourage others to make use of their friends and family as well.
Yeah, that's great advice. Is there anything else that you wanted to share with listeners before we turn things back to Becky to see if there are specific questions for either of us?
I would say the one thing is, if you are a patient, if you've been diagnosed with encephalitis or frankly any form of brain injury, know that things will get better if you put the work in. You may never be the person you were because your brain suffered a traumatic injury of sorts, and it's never going to be the same, but it doesn't mean that you can't improve. And just be willing to do the work, be patient, believe in yourself, and believe in the fact that your body can heal. And that's the one thing that I never want people to say, that's the way things are today or the way things are going to be forever.
Thank you, Jennifer.
Thanks for sharing your story, Jennifer. It's a very powerful one. And I couldn't help but smile when you were talking about the gun being broken, because I think, and your phrase was perfect. You don't know what you don't know. And Arun, I'm guessing this makes it very difficult for the medical community when we don't know how to tell everything because we're not really sure what else is going on. But I could relate to your story, Jennifer, when you kept thinking the gum was broken, because I did not realize I'd lost sense of taste and smell. And so I would be cooking dinner and I'd put garlic in and try to smell it, and thought the meat was bad. So I'd pour more on there, and my husband would walk in and he'd be like, whoa, what are we having with the garlic? And I'd be throwing the beef out. And, we went through this. There's no telling how many pounds of beef we went through. And at one point I said, don't buy meat from Albertsons anymore. I only want it from Tom Thumb. And then, of course, that meat was bad too, right? Because I still couldn't smell it and didn't know that. And then I decided, it has to be bought the same day that it was packaged. I'd season the heck out of that, and I'd be dumping it in the trash. He'd be like, no, it's good. So, but I never knew that I couldn't smell or taste, and I could not report that. So I just have an appreciation for the medical field for, when you're dealing with something like this where we can't necessarily communicate all of the symptoms that we're going through or experiencing, that definitely makes the challenge of diagnosis even harder.
It is a challenge. I would say as neurologists, I think that, we're really putting together pieces of a puzzle when we encounter patients. And, the biggest piece of that puzzle is provided, of course, by the patient, but we rely heavily on family members and friends and so on to provide additional pieces of that puzzle to fully round out the story.
That's great. So we did have a few questions that people submitted. I will start with one for you, Arun. This person is asking, how long should the patient work with their neurologist? In this particular situation, they said that thankfully the seizures have stopped over time. They no longer need medication to control the seizures. So at that point, are they just good to go unless they have new issues that come around? Or once you've had encephalitis, should you have an ongoing relationship with your neurologist?
Yeah, it's a good question, and there are a couple of ways to answer that. So one is, I think it depends on the type of encephalitis that one has. So, for example, a viral encephalitis like herpes simplex virus or West Nile, these are typically one-time events where there's an acute period of inflammation and then that subsides. That is very different than a situation of autoimmune encephalitis, of which examples are NMDA receptor encephalitis and others, where there may be relapsing disease. So one can have a period of inflammation, it might get better, but then there can be subsequent periods of time where there's a relapse of inflammation. And so in those cases, certainly I would advocate for more diligent surveillance on the part of the medical community and more frequent visits with the neurologist. In either case, encephalitis can result in long-term consequences. You can certainly have a seizure disorder that develops as a result of encephalitis. There can be headache disorders, there can be changes in personality or behavior or cognitive function. And I think in those cases, it really becomes a matter of establishing a relationship with either a primary care physician or a neurologist who will be able to track those symptoms and really help tackle any outstanding issues that continue to persist over time.
Okay, thank you. And another question that came in is somebody that they had encephalitis, let's just say 7 or 8 months ago, and they are having anxiety attacks, and they're wondering, could that relate back to encephalitis? Is it something that new? And we hear this quite often that people who have had encephalitis later encounter some of these things, and they're not sure, does it tie back, or is this something that new I should worry about? But in your experience, how would you comment on that, Arun?
Yeah, so we do know that mood disorders can emerge after encephalitis, so really after any brain injury that can happen. And so one possibility is that that's what's happened. There's been some structural or functional injury to the brain that's resulted in the emergence of anxiety. I would have to issue a word of caution, though, that we are recognizing more and more that there can be psychiatric manifestations that are associated with encephalitis, and particularly autoimmune encephalitis, like anti-NMDA receptor encephalitis. And so if after an initial bout of encephalitis, if dramatic new symptoms like anxiety or severe depression emerge relatively quickly, then that has to raise concern for the possibility of a relapse of autoimmune encephalitis.
Okay. And Jennifer, this one is for you. I'm sure you and I probably have a similar situation where a lot of people say, well, you look fine to me. I'm glad you recovered fully. And, inside you're thinking, it couldn't be farther from the truth. What advice do you have to other survivors when you're faced with that invisible illness? How do you respond to people when you get asked that question?
Yeah, that's a great question, Becky. It honestly, it's one of the most hurtful things for me to hear that. And the reason for that is because it doesn't acknowledge the fact that there's this inner pain that you're experiencing. And for many of us who live with individuals, it's a tough one. Oftentimes I think about who the person is in relationship to me, how if it's a friend or a sort of a more distant person. Sometimes I'll just say thanks for your concern. I'm glad that I've recovered as well as I have, but I'm still working on it. If I'm feeling a little, shall I say, feisty, sometimes I say something like, thanks. I hope you never have to walk a mile in my shoes, which is just to sort of let people know that there's more going on than kind of meets the eye. But for people who are in either say caregivers or people who are in that sort of who come across an encephalitis patient, it's not a helpful comment. It just is not. And so I do think that the more that the people recognize that, it would show a bit more compassion. But as survivors, I feel okay speaking up and just saying, just sometimes acknowledging that that's not actually what's going on beneath the surface.
Okay, yeah, good way to respond to that. Arun, another question many people have is post the chronic, or I mean, during the chronic phase, post the acute phase, a lot of times they may be working with a neurologist that hasn't worked with very many other encephalitis patients. And often it's kind of a dismissive feeling of, well, you know, you look fine to me, so you're good to go. What advice do you have for survivors and caregivers that truly need to stay engaged with their neurologists? And how do they nurture that relationship to get the benefit that they need out of it?
Yeah, that can be difficult, Becky. I think that as physicians, when we're comfortable with conditions, it allows us to be more comfortable with providing care for the entire patient. When we're less comfortable with conditions, it's more challenging to do so. And so what I typically will tell patients is, look, you've got to ultimately, if you have the means and the resources to do so, you've got to find a physician who's familiar with the condition that you have in order to really establish that connection that you need. And I think through efforts like yours and through others, other organizations devoted to encephalitis, I think that there is growing recognition of the need for physicians in this area. And there is growing interest among junior neurologists to enter into this field. And so I'm heartened by that. I think that there are going to be more neurologists who are comfortable providing care for patients with encephalitis moving forward. In the meantime, there are online resources that would allow patients to find physicians who have expertise in encephalitis. And even if an in-person meeting is not possible, perhaps just chatting or emailing may be helpful.
Okay, good advice. We only have time for one more question. I'll just end with this last one here. So some people have had some recovery, fortunate enough to have some cognitive recovery. The question is, you know, at some point, does it ever get as good as it's going to get, or is there a chance to improve cognitively even more down the line?
Well, let me take a first stab at that, and then I'll turn things over to Jennifer, because she I imagine has a perspective on this as well. From my standpoint, there certainly can be improvement. That improvement can occur not just in the first few weeks to months, but can occur a year or even longer out from that initial bout of encephalitis. In patients with autoimmune encephalitis, that window may be even longer, because sometimes there's residual inflammation that is not being adequately treated. And if that gets treated, patients can further improve. And so my perspective on this is that I am quite optimistic in many cases that improvement can occur over an extended period of time. I'd love to hear Jennifer's thoughts as well.
Yeah, no, I appreciate the opportunity to share that. I fully agree. I think that there is a, you know, sometimes I think that recognizing that some damage is profound, and there may be sort of limitations on how far a particular individual can go depending on that. But for me, I think that should never stop someone from work, because taking an active role in your recovery is something I think that it creates a sense of agency and a sense of responsibility that you have some control. It may not ever experience a full recovery, but an improvement from the baseline of where you were during the, you know, kind of that's a win. And I remember my neurologist explained to me part of the illness, saying, look, you know, you had connections broke in your brain, and he likened it to a kind of the inner, saying, you know, maybe you were able to take these flights from Seattle to LA and it took this amount of time. But right now, as your brain is working, you're going from Seattle to New York to LA. You're still getting to the right place. It's just slower. And he goes, but it will get better. Your brain will find faster ways. And that was an incredibly hopeful message for me. While frustrating, it was also hopeful because it said, hey, there are things I can do that I can work on this. And I do recognize that there are some situations where people, there are limitations, but at the end of the day, taking that active role and saying, I want to accomplish this is the most important thing that anybody can do whenever they've had, an injury, the ones that get from encephalitis.
Well, thanks, Jennifer, and thanks, Arun, both of you for your time. I guess, just in the spirit of that last question, I want to end on a message of hope, and that is, I've had the opportunity to get to meet hundreds of survivors over the last, 7, 8, 9 years now, and I see them annually on a lot of them. And when I do see them, I would say 90% of the time, I have seen a remarkable improvement from year to year. And so I just want to say, brain plasticity is real and that there are options. I myself went through CogMed training. There's others out there. I'm not endorsing that in particular, but for me, it certainly helped with short-term memory. And there are tools and programs out there that can help to where, like Jennifer said, you may not ever get back to where you were, but you can get closer to your baseline the more you expose yourself to these different tools. Thank you again, both of you, for your time and wonderful advice. And thanks for sharing your story, Jennifer. That's a painful journey, but we're glad you're on this side of it and that you can share with others and help people learn. And thanks, Arun, for your advice. We always learn a lot from you, and I'm just thankful that we're all here together on World Encephalitis Day, and hope all of you have a wonderful rest of the day. Thank you.
Thank you.
Thanks, Becky.
Thank you.